Hi, I'm Bob Weir with another interview about the COVID-19 pandemic, specifically the mutation of the disease known as Delta variant. My guest is Dr. Matt Richardson, Denton County Director of Public Health. I interviewed Dr. Richardson on Zoom in March of this year. Now, although we've both been vaccinated, Dr. Richardson requested that we wear masks to emphasize the need for caution during this latest cycle of infection. Thanks for being here, Doctor.
You bet.
Let's begin by, if you would, we've all heard of the Delta variant and we've been told that it's extremely contagious. So my first question is, are vaccinated people protected from it?
In short, yes. Vaccination continues to be our best line of defense, and it is very effective. I will note that there are breakthrough cases with the Delta variant. What's happened is the virus itself has changed. It's mutated and evolved over time, and that mutation has confused our immune systems just a bit. So the latest research out of the New England Journal of Medicine says that the vaccines, the mRNA vaccines, are essentially 80% effective in the field against the Delta variant. So 80% is great. That also means up to 1 in 5 people could still be vulnerable to Delta even though they're fully vaccinated. 4 out of 5, 80%, are fully protected.
I see. So, so the Delta is stronger, and it could actually...
It is. Epidemiologically, we talk about the transmissibility of a pathogen. Influenza has an R naught, R sub 0, if we love our calculus and our algebra. But the R naught is this formula of how transmissible a pathogen is. Flu has an R naught of 2, so for every 1 case of the flu, you basically create 2 more cases. The original SARS-CoV-2, COVID-19, had an R naught between 3 and 4. Every 1 case of COVID-19 created 3 to 4 new cases. The Delta variant may be 6 to 7. So the R naught, every Delta variant case can create 6 or 7 additional cases of COVID-19.
All right, well, let's talk about something that everybody's talking about. Should people wear masks even if they've been vaccinated?
So there you go, right?
Well,
we answered our own question because we know that Delta is more contagious.
Right.
We know that cases are up. Hospitalizations in Denton County are up. We had over 150 people hospitalized yesterday in Denton County with COVID-19. These are people sick enough to be at the hospital. We had as few as 3 ICU beds in the county just a few days ago. So what we're seeing is the intensity and the severity of the Delta variant is severe, and I'll note the vast majority of people that are hospitalized, well over 90% in Denton County, unvaccinated. So we continue to see science is bearing out the vaccine is very, very good, and not having it very, very bad.
Yeah, well, the numbers don't lie, I
They
suppose.
don't.
So. All right, so then how about should children, everyone, even children, regardless of age, get vaccinated?
So the vaccines are only licensed for ages 12 and above. So the Pfizer vaccine specifically, between 12 and 18, you've only got the one option, which is Pfizer. It's a very good vaccine. It is that mRNA technology, an excellent vaccine. But 0 to 11-year-olds don't have a vaccine choice. And so, as we've already talked about, the transmissibility of Delta being so high, we need to protect those kids. The way to protect is what we call cocoon, making sure everyone around children is vaccinated. Makes good sense. And then we need children to wear masks because they don't have any other line of defense.
Oh, my very next question, because we're hearing a lot about that in the school districts. School is starting again, and a lot of controversy about whether or not they should be wearing masks. I think the governor said that executive order they don't have to wear a mask, but schools there are schools in the in various cities that are saying they won't go along with that.
As of this morning, I think Dallas, Fort Worth, Houston, maybe now Austin are bucking the governor's order, and I think that will be litigated in the courts.
And Fort Worth also
yes, sir.
just started to say they're going to go against this as well. So
Indeed.
We're going to have a kind of a power struggle here with the governor and the individual communities.
Which is too bad, because in the end, whenever you boil off some of the political machinations, from a public health standpoint, which is my position, from a public health standpoint, the science is just telling us we have to protect the unvaccinated.
Right.
Because if children who are exposed, if they do become positive, again, that R naught, that factor of how many cases you get from each index case. If one child gets sick, research is saying maybe 5, maybe 6, maybe 7 additional cases from one case.
Right.
So it's really, we've been so fortunate, COVID-19 has not really punished the pediatric cohorts, the pediatric groups. It's just not as deadly, and even the illness is not as severe, but they can pass it on to the unvaccinated, and that's our biggest risk.
So mask wearing is still a preventive measure.
It is. It is.
And so one of the things that I was concerned about is, and I don't hear anything about it, how often should the same mask be used? I mean, can you keep using the same mask and leave it in your car with 100-degree heat? And then, I think maybe there are germs in there that are growing and then you put it back on.
Sure. I think we always talk about making sure that the mask doesn't have any visible stain or dirt. Obviously, cloth masks can be washed. Cloth masks are helpful as well, and they can be washed. Disposable masks, I'll be honest, I'll use a new one every day because I'm meeting with different groups of people. I meet with staff members. We do wear a mask, but I typically use a new disposable mask every day. That's a personal preference. It can go longer, but I like to get a clean mask every day and start from
when
scratch.
we were wearing masks, my wife and I wearing masks regularly before the lockdown ended, we had several masks, and I didn't like the idea of using the same mask over. So we take that mask and throw it out, take it out, and next time we got out, you go through a lot of masks.
You do.
But I mean, it's worth it if it's for your health. What is an N95 mask, and is it superior to other masks?
An N95 mask is what they actually call a respirator. So it is fit to your face. It does block off any outside air. In other words, you should not be able to inhale air that is not filtered through that mask. So an N95, OSHA refers to it as a respirator. The way you know it works is to be what we call fit tested, meaning in healthcare situations, in our office, for instance, in our TB clinic, we make sure our nurses and doctors wear an N95. We test to make sure that it fits perfectly. We put a saccharin fog in a tent around the head, and if you can taste sweet, that means you have leaks. For an N95 to work appropriately, you would have to do that fit test. Otherwise, it is a little better than a surgical mask because it can fit around your face.
Where does a person get it?
But so you can buy N95 masks off the internet. You can buy them off Amazon. You can go to medical supply companies. But again, for it to be truly effective as a respirator, it would have to be fit tested.
Right.
We recommend surgical masks because very few people had the equipment to fit test an N95.
Gotcha. How about, do you foresee another vaccination coming, for example, a booster shot?
This is the question we get most often. Makes sense. One of the challenges is the more people that get sick, the more infections there are, which is the more opportunity for it to mutate, which it has done.
Right.
We're moving past Delta. We're going to enter the world of the Lambda variant coming up. Don't know what that will do.
Right.
And that won't be the last one. So the more people that are sick, the more people unvaccinated, the more the virus burns through the population. Truly, a booster is the best option. The question will be, do we use the same formula? A third shot of the same formula? Or the two mRNA manufacturers, are they going to create a new vaccine and we start over much like a flu shot? That's still up in the air.
Doctor, do you see this becoming an annual thing, like flu shots? I mean, will we be taking these shots?
We were really hoping that that wouldn't be the case, but since we still have 40% of people who are unvaccinated, we're very concerned that we've missed our opportunity to knock COVID-19 out once and for all. Now it feels like it may become a chronic concern.
Well, All right, well, you know, we covered a lot very quickly,
did.
and I know your time is valuable. I really appreciate you coming here and giving this information, because everybody out there is talking about it. It's so important. So thanks for taking the opportunity to update residents on this. This is a continuing saga with this thing.
Bob, thanks so much for the opportunity. I appreciate
So I
the
guess we'll
time
do
with
an
you.
elbow
You bet. We
thing.
can do elbows. Thanks so much.
And thank you, Doctor, and thank you for watching.